Gallbladder 16 is located on a curved line joining gallbladder 15 to gallbladder 20. It's 1/3 of the distance from gallbladder 15 to gallbladder 18, which is on a level with DO20. This makes this your gallbladder 16. Gallbladder 14 is located above the pupil looking directly forwards, 1 cm superior to the eyebrow. To locate this point you need to stand directly in front of the person, have them look forwards. Remember the distance from the centre of the glabella to the anterior hairline is 3 cm, which would enable you to calculate your 1 cm. You can locate this point in a dip that's formed when the brow starts to come away from the skull. Sanjiao 23 is located towards the lateral end of the eyebrow in a nice dip on the supraorbital margin. If you palpate towards the end of the eyebrow, on most people you'll find there's a nice cleft in the bone. Gallbladder 3 is located directly above stomach 7. Palpate over the zygomatic arch and feel for a nice dip just above its superior border. Gallbladder 12 is found just a few fen anterior and inferior to the extra point peaceful sleep. Large intestine 20 is located in the nasolabial groove, level with the midpoint of the ala nasi. The ala nasi is the nostril, so find the superior border of the nostril, the inferior border of the nostril, hence the midpoint, and come out into the nasolabial groove. Stomach 4 is located 4 fen lateral to the corner of the mouth. It's in the nasolabial groove. Have the person smile and you can see this point falls nicely into that groove.
Rim 15 is 7 cm superior to the centre of the umbilicus on the midline. Rim 12 is 4 cm superior to the centre of the umbilicus on the midline. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Small intestine 3 is on the ulnar aspect of the hand. It's in a depression which is proximal to the head of the 5th metacarpal. It's in between the metacarpal bone and the muscle, and it typically lays on a level with the distal palmar crease.
Sanjiao 10 is located 1 cm superior to the tip of the olecranon process of the elbow. The point is found with the arm flexed and the hand supinated.
Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Stomach 37 is located 10 cm superior to the prominence of the lateral malleolus, 1 finger breadth lateral to the anterior crest of the tibia. Remember to use the breadth of your patient's finger, not your own. Gallbladder 39 is located 3 cm superior to the prominence of the lateral malleolus. It's in a groove in between the lateral crest of the fibula and the perineal tendon. Get your patient to avert their foot against resistance to reveal the perineal tendon. Be sure to locate this point in the groove between bone and tendon, not posterior to the tendon. Liver 3 is located on the dorsum of the foot in a depression distal to the junction of the bases of the first and second metatarsals. You can palpate up this nice cleft between the 2 bones. Don't go right in between the 2 bases, just go a little bit more distally into where there's a nice dip. It's almost on a level with spleen 3. Bladder 62 is located half a cm inferior to the inferior border of the lateral malleolus. It is located posterior to the perineal tendons. To bring the perineal tendons into relief, evert the foot. This is the perineal tendon here. When the foot is relaxed, the point can then be marked behind it.